All right, so I wanted to make a quick video about Dentrix. The biggest complaint / issue that I have temps coming to me about is that they don't always know the different systems that offices work with. So I just wanted to go over just a few quick things with Dentrix. Dentrix, I feel like, is one of the easier ones to work with. It's very easy to navigate. If you look up at the top, I know it might be a little difficult to see my cursor. I hope you can see it. But if you look at up at the top, each one has different buttons. So like the first button is the patient chart. Here's your family file for the different patients, your ledger. There's the office manager button. Now, as a hygienist, not all of these buttons will necessarily pertain to you. A lot of it is front office work. And also a lot of it is back office work, you know, for dental assistants and things like that. So I just wanted to go through just a little bit of it with you. So if you look here in the corner, there's a little button that you can click on that'll bring up your calendar. When you're scheduling appointments, this makes it really easy for looking out to the different days so that you can click on to see what their schedule is like. Now, sometimes when you're filling in, they may not necessarily want you to do that, but it's always nice to be able to offer that option if you know how to do it. So if you're ever looking to schedule, so let's start with that first. So if you're looking to schedule, what you would do is you double click on the area that you want to schedule. So like right now I'm looking at 7 o'clock on a Friday morning. So this will come up and it'll put in, you'll type in the patient's name. And then you'll type in the patient's name, it'll come up and it'll come up like this. It'll bring up the patient's chart. You'll go in and it'll bring you to this screen. And this is where you can go to schedule whatever you want for the appointment. So you'll click on initial, and that's where you would be able to pick, you know, if you're doing bite wings or you're doing just the adult prophy or you're adding a periodic exam or the patient needs fluoride. I've already created the appointment and I put in this visit. All they were doing was just a periodic exam and then a prophylaxis, adult prophylaxis. It gives you the ability to go through and click how much time you want to schedule the appointment for. So you would just click the time. I always put insert dateline. That tells you when the appointment was scheduled. Sometimes it can be very confusing for the front office and also the back office to not have that in there because you really don't know when the appointment was actually scheduled. Now, it will say up here as well, but it's kind of just an extra confirmation. And especially with everybody being booked out so far and everybody having missed the appointment with COVID, it's nice to know because if you see that it was scheduled before COVID, you may want to go back and check to make sure that they're not due for x-rays because of the fact that they skipped an appointment. They may now be due for x-rays. If you need to add treatment, anything that would have been in their treatment plan would be in the add treatment section. If you want to add new treatment, you can go to the new treatment button and then look up the procedure based off of whatever treatment that you would need. And Dentrix is nice in the fact that you'll click on whatever you're looking for. So if you're looking to schedule, say you're looking to schedule a scaling and root planning for a patient, you click on perio and it'll come up. You know, you have your full mouth debridement, you have your gingival flaps, you know, you have your bone replacement grafts, you have all of your scaling and root plannings, your full mouth debridement, your local delivery of an antimicrobial agent like Arrestin. It'll have your periodontal maintenance. You know, if you go into orthodontics, it'll leave all your orthodontics codes. Preventative for the hygienist, it'll list all of your adult prophylaxis, kid prophylaxis, topical fluoride, you know, oral hygiene instructions, sealant. So that is the option to be able to treatment plan things through that menu. There's many different ways that you can treatment plan things, but this is to be able to do it from that specific appointment if that's what you're scheduling. The other thing that you want to make sure that you do, now as a fill-in, that may not be something that you'll want to do because of the fact that you're not in their system. But if you're in their system, what you'll want to do is click on this one and it'll bring up the provider, and then you click on the provider, and whichever provider will be providing that service for the day. Now, if you want to move it to a pin board and you're looking for an appointment, day, like say I didn't want to schedule this appointment I put it on December 4th, but the patient can't come in on December 4th. What you would do is you would click on pin board, which is down here at the bottom, and it'll pin it to this little list over here. And then all you would have to do is drag from that list and put it in the appointment where you want it to be. And it'll say, do you want to schedule this appointment here? And you'll click yes. And it is set, well, this time it's not open at this time because the office isn't actually open. But because of HIPAA purpose, I was trying to keep you from seeing the actual schedule. But you would just obviously click yes, schedule the appointment, yes, override it, yes, schedule it. Okay, so that's the basics of scheduling an appointment. Now, if you want to go into the chart, you're going to click on the tooth. That's going to bring you up to the general chart of the patient. Once you get into the chart, it'll bring up everything that you need to see. So this is an established patient. It's another hygienist friend of mine. You can see they already have listed the existing restorations that they've had done from previous offices. And so we'll kind of go over that. I'm going to go over that real quick to show how to do that. So say you wanted to list the tooth was, they had an existing mesiofacial composite on here. So over in this corner, you'll see all the procedure buttons. Now, every office is going to be different in that. So I highly recommend that you come in a little ahead of time. If you've never been to the office before, I say this all the time, come in early, 15 to 20 minutes early to familiarize yourself with the different things in the office, such as the procedure buttons. This is really great, and a lot of them are quick code buttons that all you have to do is click on the code. It'll bring up the code, and then it'll put it right into the tooth. So I'm going to show you that right now. So say she has an existing occlusal composite that you wanted to add. You would go click the little button that says composite, which is a D2330, and then you would hit existing, and then it'll bring up the surfaces. You want to pick whatever surfaces you're putting. You know, if they have an occlusal, you add an occlusal. If it's an occlusal and like a mesial, or an occlusal and a distal, or an occlusal and a lingual, if you wanted to add a surface, but it's a separate filling, what you'll do is you'll click add, and then you'll add, say, the lingual, and then that way when you treatment plan it, as you can kind of see here, it'll show the occlusal surface, but it'll also show the lingual surface as two separate fillings. Now, I'm going to go in and delete that I'll eventually go in and delete that because it's not actually in her chart and I don't want to mess up her chart. So I'm going to show you that too. If you accidentally do something that you don't want to do, you'll go down here to progress notes. It'll show the procedure that you just entered. And what you're going to want to do is you're going to want to go in and click delete, and it'll say delete all selected items, and you click yes. Now, same thing if you're going to be adding a filling. And this is really great when the doctor comes in, you're trying to add treatment into it. You know, the more treatment that you can add, it helps the front desk a lot, and that makes things easier for them. So same thing, click on tooth number 2. You're going to go to the resin anterior composite, you know, whatever you're putting in. But instead of putting existing, you're going to go to treatment plan. And same thing, you're going to pick whatever surfaces that you would like. You know, I'm just going to say a DO. We're going to do a distal occlusal composite filling on her. Now it'll show up red. Now I will say this, every office is different. It's red in this office that needs treatment planned and is outstanding treatment. You're going to want to ask every office what their color system is. Every office is different. This office happens to be blue was done at another office. Green means it's completed here. And then red means that it needs to be completed. So I'm going to go, like I said, I'm going to go back in and delete this because it doesn't actually need to be done. So we'll delete that. It'll be up in the treatment plan. You'll go into the treatment plan. You'll delete it, procedures, say yes, and then that's how you can delete the procedures. But like I said, every office is different. They all have different codes that you can add. So like here is a crown porcelain fused to metal code. Here's your sealant code. Here's a watch the tooth code. A lot of people will have you say, okay, I want you to watch the distal of this tooth. So say they wanted us to watch the distal of number 8. You would click on watch the tooth. You'd treatment plan it. It'll say watch the tooth. What you're going to want to do is go in and click on it. It'll bring up this part of it. It's very important that you go in and write what surfaces they want you to watch, because otherwise it will not tell you specific surfaces unless you click on the code to show what was in there. And if there's nothing in there, they're not going to know. So it's very important that I would just put watch distal, and then you'll click OK, and then it'll show a little music note in the corner, and it'll show what surfaces that you wanted to watch. It will also come up here. It's very difficult to see because it's in black, but it does have a little W on there to be able to show what surfaces that you want to watch. Once again, I'm going to go in and delete because of the fact that this is not an actual patient chart. Now you'll go into your clinical notes. Now I'm not going to actually click on the clinical note button, because once you've created a clinical note, you cannot delete a clinical note like that, the date from it. So I'm just going to go into the note itself. What you'll do is you will click on here where it says new clinical note. Now, for instance, they have specific, if you look over here, each person has their own specific template. This office is nice enough that they have a temp hygienist template, which is really great because at the end of it, normally it'll have like the other hygienist's information. It'll just say temp, and then you can just fill in whatever information that you need. They have a prophy, a 3-month, and a full mouth debridement. Now there are other things that you can create and custom create the templates. That's not something that I would necessarily get into as a temporary or a fill-in hygienist or dental assistant. But it is nice to have the templates already created, because it makes things a lot easier for you when you're going in. You know, the doctor that is here, you know, they have your new patient exam, your prophy exam, your, you know, any of the templates that you would need. So that's something that I would definitely go in ahead of time and just see what their templates are, see what information you need to fill out so that you can do that ahead of time. I highly recommend, so that you don't forget to write notes. Make sure that as soon as the patient is seated in the chair, start the clinical note and start filling in as you go, because otherwise, you know, as hygienists, dental assistants, things get crazy. It's a lot easier to be able to start your notes and finish them at the end of the appointment than to have to try and backtrack and go back later and restart notes. Now, that kind of covers clinical notes a little bit. I just wanted to briefly cover that. Progress notes. This will show all of the treatment that they've had completed. This is great if you're trying to look back to see when their last set of x-rays. So for instance, her last set of x-rays I'm looking back are from 2018. So when she would come in, I would certainly want to update her x-rays. Now it's always important. Now, a lot of times the front desk will check for you, especially if you're not familiar with their systems. But if you're not familiar, one thing that you can do is if you go into their family file, it's the little manila folder with the little people in front of it. If you click on, now she doesn't have any insurance, but typically you would click on their primary insurance and you would go to coverage table. And once you go into the coverage table, sometimes offices will put it in there. There'll be a little section that comes up notes section. Typically in the notes section, it'll tell you their coverage table. Are they eligible for bite wings? When was the last time they had bite wings? Now, not every office does this, but if they do, it's a great resource to be able to see if they're eligible. Now, you don't always, now up here you will see, like it says 4/17/19 bite wings. If it was for some reason not put in the system correctly, this is not always accurate. So I would not suggest always going by that, because you never know if it's accurate or not. So that's not exactly the best place to go to check accuracy if they're actually eligible. When all in doubt, always check with the front desk, because you never want to take an x-ray that they're not eligible for or that they would potentially owe for, because you want to make sure that you discuss that with the patient first to let them know that they would have an out-of-pocket expense. Another thing that's important to look at in this upper section where all of the treatment planning is you'll see this little probe. That's where you're going to want to go to do any kind of perio charting. So you would click on that. It'll bring up the patient's perio chart, and that's where you would go to insert your perio charting for the patient. And that's something that's very important as hygienists for us to make sure that we're doing. Another thing is if you look at this little white flag here, she doesn't have any patient's alerts. If she did, this is somewhere where you can go to put patient alerts in, you know, such as the patient needs a pre-med, the patient had a referral sent, you know, they have an existing appointment due. That's where you can go to insert stuff. Now, if there's already something in there, it'll be red. The flag will be red. So that's something to look for if you're looking for alerts. Typically, allergies, things like that will be in there as well. Same thing next to it, the little white thing, little white plus sign, that is your health history. If that is filled out on the computer, some offices do that, other offices do not. If you wanted to see their medical history and it was filled in, it would be red. So that's another thing to look at, is to look at their health history as well and make sure you're updating that. Here is where your patient picture will be. If there's a patient picture, it'll come up right there. This is your prescription box. It'll look like a little pill bottle with an RX. If you need to prescribe a prescription, this is where you would go to do. That's something that I can do a more intense video about later on. If you need to refresh is important. Sometimes if you put treatment in and it's not showing up, you'll want to hit the refresh button to make sure that everything is up to date. If you have a child patient in and they have mixed dentition, you can change the teeth. So like, for example, say this was, it was actually a primary tooth and it was in as an adult tooth. You would go over here where it says primary/permanent. You'd click on it and you'd click change selected, and it will, well, because that was a permanent, that's not a good example. You'll click change selected and it'll turn it to a primary tooth. Now, if you did what I did and you accidentally put where there is no primary tooth, you'd click on it again, you'd go back and you'd click change selected, and it will change it back to a permanent tooth. These are just some basic things to go through in Dentrix, the basic buttons and codes you'll need for using Dentrix. Dentrix is very user-friendly. You know, like I said, when you hover over the things, it'll show you the different things. Like that'll bring you back to the appointment schedule, give you the ability to schedule. It has all of your time frames on the side so you can make sure you're keeping in track with time. If you need to move an appointment down, you can do that by clicking in the corner. The little music note here in the corner, that'll bring up all of your health history notes as well. So that's another quick click that you can do. It'll show any appointments that they have scheduled, any health history notes. Some people will fill out patient notes so that if there's any, you know, they only like to go back to a 45-degree angle, or they request a neck pillow, or any kind of patient notes, that'll be shown in there. And not everybody uses all these codes, but that's why I always say come in ahead of time, familiarize yourself with the codes, and just, you know, anything that may be up in here, you'll be able to know from there. So this is just a quick little intro tutorial video of Dentrix. If there's anything specifically you'd like me to cover, please drop that in the comments below, and I can do an individual tutorial video on that, okay? Hope you guys enjoyed this video.